Disclaimer, this talk is not focused towards leaving your homeland. I have huge respect for doctors serving in Pakistan. Always aim for professional excellence. That's why we seek for the best place for training and always give back. That is precisely what I'm doing right now. A little bit about me. I graduated from King Edward Medical University in 2009. I was postdoctoral research fellow at Stanford University for 3 years after that. I did internship in general surgery at Yale University Waterbury Hospital, and I did my residency from Geisinger Medical Center with many fellowships in IR, interventional pain, and MSK imaging. And then I did my full-fledged fellowship in vascular and interventional radiology from Geisinger. I was an attending at UPMC, University of Pittsburgh Medical Center, Susquehanna. I was vice chairman of IR there from 2020 to 2021. I did an MBA from ASU, Arizona State University, with majors in leadership, entrepreneurship, and finance with artificial intelligence, machine learning. I'm currently working as an IR doctor in Chicago at Rush University, Copley Medical Center, and St. Anthony Hospital. So why listen to me? Why listen to anything I'm saying here? I launched Medidia.com, a website, as a fourth-year medical student at UKE that became a big hit over the years, and it has been serving as a platform for helping and mentoring IMGs for 13 years. IMGs are foreign medical graduates applying for residency in America. I have a YouTube channel. Right now it has around 7,000 subscribers. I am administrator, moderator of King Edward USMLE group. I was co-chair of Young Physicians Committee of UPNA in 2015-2016, and I was also co-chair of YPC Gymkhana in 2014-2015. For the past 2 years, I'm the chair of YPC Gymkhana. I have published 12 research papers, presented over 40 presentations, posters, wrote a book chapter, reviewed over 35 research papers for British Medical Journal, Lancet, McGill Journal of Medicine, and Annals of Internal Medicine. I'm the youngest recipient of Distinguished Service Award by Gymkhana when I was a final year medical student for patient philanthropic work done as president of SPWS. Just showing off some of the awards that I got for my research work. I got first position at Yale University for best research poster presentation. During my entire residency training every year, I was awarded by my medical institution for best original research presentations. Also, I'm the only graduate in the history of Pennsylvania to be awarded by Pennsylvania Medical Society every year, 3 years in a row, for best research presentations on during the annual retreat of Pennsylvania Medical Society. At my graduation, I got this award, which is the highest research award that is presented by the Radiological Society of North America. So at the time of my graduation, RSNA presented me with this award. These are some of my pictures, just showing off that I am one of you guys. I'm not any alien, not coming from anywhere else. This is in Patiala. I think this was our class function of final year. Let's see if I can get the pointer. Yeah. So this is class function final year, fun fair. This is right in front of Patiala. Again, fun fair. I was a member of Literary Society. This, I think, was second year. Literary Society, I think this was third year. And I also wrote in the, I think it was the magazine, the college magazine, Chemcol, I believe. Then I was one of the associate editors. So why, well, listen to any of this? As you have always heard, it takes a village to raise a child. So I genuinely believe that why I achieved any of the success, or doing this for the past 13 years, I learned that people who succeed over time are the ones who have access to appropriate and accurate guidance, early guidance. That's the key to success. The people who have access to appropriate, accurate guidance early, they are the ones who are most likely to succeed. So each one of you who is sitting in the audience right now, you are already above all those who are not sitting here, just because you are going to learn something from this presentation and you're going to carry that knowledge with you. So please take notes. If you have your cell phone, take notes on your WhatsApp, on your color notes, sticky notes, whatever you use. If you like to write down on a paper, please do that. This presentation most likely will also be available on my YouTube channel. I have my YouTube channel and my website listed here. If you have any questions, or if any questions come to your mind, I would suggest write down your questions. I'll answer all your questions at the end. So let's start by talking a little bit about professionalism. In general, I will say, don't simply hear, please listen. That was my problem as a student at K. Sometimes sitting in the audience, I wouldn't really capture everything. So then I focused that you got to listen you try to think about what the other person is saying. Always be punctual, show up 5 to 10 minutes early for all presentation, for all the lectures, respect the deadlines, always complete projects, assignments before your deadlines. Address everyone as Mr., Miss, Mrs., Doctor, last name. That's a big cultural shock coming from Pakistan. If my name is Umar Tariq, I'm never Dr. Umar. I'm not Umar Bhai. I am Dr. Tariq. So never address anybody with their first name unless specifically requested. This is a big cultural thing. If you're addressing anybody with their first name, Dr. Umar, it's more like addressing your professor with just their name, without sir, without doctor. That's the big cultural shock. So always doctor, address everybody as doctor last name. Even if it is somebody, your friend, don't address them publicly at workplace as bhai, baji. People don't understand. It gives a bad impression. Maintain strict professionalism at all times at workplace. Now, the main gear of the focus of our talk, I'm going to talk briefly how to better prepare as a medical student for training in US, a little bit about electives, USMLE exams, their importance, US residency application process, special situations, and why you can go unmatched. And at the end, I will briefly touch upon research. So how to better prepare as a medical student for training? I would say decide your specialty ASAP. Once you have decided your specialty, focus on that specialty, try to do steps ASAP, try to study the Kaplan books during MBBS, try to take step 1, which is now pass and fail only during MBBS, and preferably step 2 CK as well. I have Dr. Ayaz Khwaja's interview on my YouTube channel, and he also wrote USMLE guidance sections on my website as well. You can read that, or you can listen to the 4 experts we have for USMLE guidance. As far as Dr. Khwaja is concerned, he published 2 research papers, took both USMLE exams in last 2 years of medical school at K. So he was a K graduate, took both exams, got very good scores of 266, 268. Now the step 1 is only pass fail. There's also guidance by Dr. Furqan Ahmed. He also scored 268, 269 on my YouTube channel. You can listen to his talk as well. So briefly, what are electives in USA? So first thing I'll say about electives is decide your specialty ASAP. Why is that important? That you should try to do electives in your specialty of choice. What are electives? Electives is just a fancy name for rotations in US. There could be intramural and extramural electives. Intramural electives are the electives that you're doing in Mayo Hospital at your home institution. Extramural electives are the electives that you do outside your home institution. For example, if you go to Shaukat Khanum, if you go to Yale University, if you come to Stanford, if you go to Aga Khan, these are all extramural electives. If you're going out of the country, then those are international electives. So what are all these terms? These are some confusing terms that are not typically used in Pakistan, but they are used very frequently. Electives, I told you about what they are. The rotations that you do as a medical student are called electives. Observerships are the rotations that you do, but you're not allowed to touch the patient. You can take history, you can do everything else, but you cannot touch the patient. Clerkships are your rotations that you do in your 3rd and 4th year medical school. What I mean by that is like your basic medicine, surgery rotations, peds rotations. Electives can be any like medicine, surgery, pediatric surgery, radiology, anything like that. Sub-internship is like working like a house officer, but you're still a medical student. Internship is a fancy name for first year of residency. You're working like a house officer. And residency, again, the full training from 1st to 3rd year of medicine is residency. For radiology, it's 5 years. For surgery, it's 5 years. And then fellowship is advanced training. So let's say if you want to become a cardiologist, you will do 1 year of medicine internship, followed by 2 years of residency, the combined 3 years of medicine residency, followed by fellowship in cardiology for 3 years. So accordingly, your roles are medical student. When you're a medical student, you're doing electives, observerships, clerkships. When you're doing sub-internship, you're a sub-I. Observership, you're an observer. And you're doing internship, you're an intern. During residency, you're a resident and fellow. And once you've done all this, you become an attending. So what is US clinical experience? That's a fancy name that's thrown in the residency application process. Most of the places do not consider observerships as US clinical experience. So basically, US clinical experience is electives, clerkships, sub-internships, and even internship. Let's say if you don't match and you do a residency training only for a year, like prelim surgery or something like that, then your internship can be counted towards your US clinical experience. Why US clinical experience matters? Excuse me. It matters because recently, for the past decade, a lot of programs, they use that as a cutoff, that you need to have a US clinical experience anywhere between 4 to 12 weeks. 12 weeks is most commonly seen. So if you have that US clinical experience of 12 weeks, that gives you good letters from US attendings. And it also helps you get across the barrier, the cutoff, the filter that they have applied, that you need to have 12 weeks of US clinical experience. And minimum duration of US clinical experience, I mentioned that. Ideally, I would say try to do as much as you can. There are places that have 6 months of US clinical experience, but at least 4 to 12 weeks is reasonable, preferably 12 weeks. USMLE exams and their importance. So starting with step 1, that's the first step. It has now changed to pass and fail. In the past, it was used as the #1 filter that the program directors would apply to filter applicants. Now, it's all changed to pass and fail. As a result of that, I suggest you guys to take it ASAP, get it out of the way. It doesn't matter if your score is 270 or 230. Now they're all at the equal stage. So study for step 1 during med school, get it out of the way. Step 2 CK is now the only USMLE exam with a 3-digit score before you get ECFMD certified. So right now, this has significantly increased the importance of USMLE Step 2 CK because it's the most important screening tool that the program directors can use as a filter. And after you take your step 1 and step 2, or even before that, you can take this OET exam, which is pretty much an English proficiency test. Once you have taken all 3, you become ECFMD certified. Once you're ECFMD certified, you take USMLE step 3. In the past, it was typically taken in first 2 years of residency, whereas now it is typically taken before you apply for residency, for H1 visa, for old graduates, and especially competitive applicants who are going for competitive specialties, or people who have low scores, or just to improve your application overall. Basic guidance on US residency application process. So what are letter of recommendation? Let's say you come and work with me, you do some rotations with me. I see your work ethic, your punctuality, your discipline, and then I write you a letter saying that you're a good candidate, you're an average candidate, you're an above average candidate. So to apply for residency, you need 3 to 4 letter of recommendations. The more letter of recommendations you have from US attendings, the better it is for you. So I have a full 2-hour detailed video on LOR, letter of recommendation, on my YouTube channel, Medidia. You can listen to that. Then the next step is CV and personal statement. I can't emphasize this enough, that how many applicants every year they go unmatched because they have spelling errors, punctuation errors, grammatical errors in their CV and personal statement. So ERAS has a specific format of writing CV. You got to follow it and make sure your CV is completely free of errors and has everything mentioned that is requested. And for personal statement, there is a structure. We're going ahead of time, so in the interest of time, I will move forward. But briefly, you need to follow that structure for personal statement. It needs to answer a few basic questions: why you're choosing medicine, why you're choosing this specialty, why this program, where do you see yourself in future. So just make sure you follow that structure, and your personal statement is also free of all errors. Always make sure your CV and personal statement is reviewed by native English speakers. Then picking programs to apply, make sure you start doing research 1 to 2 months before residency application process begins, so that you know how many programs you're going to apply to. You're going to email programs, phone call programs. Make sure you ask them what is their filter for, or not even their filter, what is their eligibility criteria? Do they accept foreign graduates? If they do, what is their score cutoff? A lot of programs will apply score cutoff of, let's say, step 2 CK of 220 or 240. That means if your score is below cutoff, your application will not be even looked at. So put in your time, call programs, email them, ask them what is their cutoff, if they sponsor visa or not. If they do, what visa they sponsor. And then after doing all that, a lot of people fail because they didn't prepare for interviews. I have an applicant from last year who had scores in 270s, excellent CV, excellent personal statement, got 25 interviews, did not match. The reason he did not match, because we had mock interviews last year. His setup for interview was very poor. He lived in a place where I would say that there were a lot of people walking by and there was a lot of noise. So when I did his mock interview, I told him that's the reason he didn't match. This year, he's going to take all his interviews from library. So please don't underestimate the importance of having correct setup. And then pre and post interview communication. Before interview, you want to make sure when you apply to program, you tell them that you like this program. Post interview communication, you've got to tell the program that you had a good time interviewing with them. If you like the program, how you're thinking of ranking them high. If you have any ties, you're going to mention them that you have family ties, geographical ties to the area. So then that's where the pre and post interview communication comes in. So I mentioned that the importance of accurate English for CV, for your personal statement. So the number one reason I see good applicants with great scores to go unmatched is because of poor communication skills. They have spelling, grammatical, punctuation errors in their CV, personal statement, and written communication. For that, I recommend you guys to read this book, Elements of Style. It's a book that is taught in US. Many of the high school students read this book. I remember when I was in Pakistan and doing FSC, we used to read Wren and Martin, which is another very good book. But Wren and Martin is mainly focused towards Britain English. So let's say this is Wren and Martin of American English. So it's a very good book. Ranking programs in general, once you interview at programs, then you have to decide, let's say if you interviewed at 10 to 15 programs, then you have to decide which programs you're going to rank. So there are different criteria people use. Sometimes people will rank university program higher than community program. University programs are the ones that are affiliated with the university. Community programs are the ones that are not affiliated with any university. Fellowship, in-house or in-house fellowships or absence of them. Most of the people will prefer to go in programs where they have their own fellowship. Let's say if you're applying for medicine residency and you're interested in cardiology, you want to look at if that program has cardiology fellowship or not. And then if the program takes its own graduates, residency graduates, and fellowship. Once you look at all that, there is a higher success rate for good fellowships and job placements. One big factor that a lot of people look at is J1 versus H1 visa. H1 visa means that once you complete your residency, within 1 to 2 years, you get a green card. J1 means that you have to do the waiver, and then after waiver, you can apply for green card. The process can take anywhere from 3 to 5 years after residency. And then geographical ties, of course, if you have family in an area, Chicago, New York, Houston, you're going to rank that area higher. Cost of living is a big one for couples and people, kids, applicants with families. So they're more likely to rank places that have lower cost of living higher than the places that have high cost of living. For females specifically, location safety, they tend to look at crime rate. If it's a safe area, they're more likely to rank it higher. Now, special situations. What are special situations? So I'm going to mention some of the special situations. If you are interested in a highly competitive specialty, let's say Rhodes is the name, the abbreviation that's used for really competitive specialty: radiology, ophthalmology, anesthesiology, dermatology, surgical specialties like neurosurgery, orthopedic surgery, plastic surgery. For that, if you're interested in a competitive specialty, the way you can match in that is to do research track, which is what I did. Apply for research at a top university in US. And then once you do research for 2 to 3 years, have published multiple papers, then you can apply for residency in that competitive specialty. And I will briefly talk about the research as well at the end. Also, I told you about Rhodes. The last one in Rhodes was surgery. So for the surgical specialties like ENT, ophthalmology, orthosurgery, neurosurgery, general surgery, the other pathways, a lot of people do prelim surgery. What is prelim? You only apply for 1 year of training in general surgery. And then after you have that 1 year of training counts as US clinical experience. Then you apply for these specialties to get the categorical or advanced training in which you will get the full-fledged training. Let's say the neurosurgery residency that is 7 years or 5 years of orthopedic surgery. Then there's a pathway of double training. A lot of people do full-fledged residency in medicine. Then after doing medicine, peds, family practice, after doing that, then they apply for the competitive specialty for residency training. And then there is alternate pathway. Alternate pathway is do your residency training in UK or Pakistan, and then you apply for fellowship in US. Then the special situation is how to match as an older graduate. So if you have graduated more than 5 years ago at the time of your application, good scores, research, good letters. Now, this is typical for most of these situations, special situations. If you have low scores, if you're an older graduate, if you're going for competitive specialty, you need to have good scores. Research will really help you. And by research, the time length of research doesn't matter. What you did during that time matters. How many papers you published, how well cited your research was, how good your letters are. How to match as an applicant with poor scores or failed exam. Again, same thing. Research, good CV, personal statement, good letters, good, and you can't improve your scores. That's why you're in this situation. How to match in a highly competitive fellowship, cardiology after medicine, GI after medicine, or IR after radiology. Research, good letter of recommendations, good CV, personal statement. Why can you go unmatched? What does that mean? After doing all this, you applied for residency and you didn't match. So I give you an example from last year when an applicant didn't match just because he didn't have a good interview setup. So the number one reason you can go unmatched is low scores, less than 225, or an attempt in exam that you failed the exam. Now, I say this because this could all be fixed. This could all be somehow compensated by long-term research for 2 years or so in which you publish. If you don't publish and then you have one of these conditions, then you're more than likely to go unmatched. Then the next one is poor communication skills or having too many mistakes in CV and personal statement. Your CV and personal statement should be pristine. There should be no errors, no spelling mistakes, no punctuation errors. So make sure you get your CV and personal statement reviewed by native English speakers. Poor interview skills, I briefly talked about it. If you have poor English skills, you can't talk properly, then practice. So make sure you improve your interview skills. You talk to somebody, you work during your electives, you do research, and you talk to your mentors, and you improve your interview skills. Then there's poor planning for match, applying to very few residency programs, not putting in the work to filter, to select programs. There's a rule of 1/3. You want to apply to 1/3 of the programs that at your level that have taken residence with applicants with your similar scores, similar elective experience, and then 1/3 that you think that's your backup. You deserve better. You can't go there, but those are the backup. And then the 1/3 where you're like, there is no way I can end up in this. My scores are not good enough. This is a place that takes people who are much better applicants than me. So you want to follow that rule of 1/3. Let's say if you're applying for 150 programs, then 50 programs should be at your level, 50 programs should be above you, 50 programs that you think are programs that are beneath you. Not interviewing at all the programs you got interview invite from, that's a big reason. Not ranking all the programs that you interviewed at. And then if you didn't match, then there is this option of SOAP, which was called post-match scramble, a supplemental offer acceptance program or something like that. Be very proactive. If there is, when you don't know that, you don't know till last minute if you matched or not. So rather than waiting till that time, I suggest last month, just start looking at SOAP. Always hope for the best, but be prepared for the worst. So put in the effort. Always consider that there is a possibility you might have to sit in SOAP. And SOAP goes very quick. SOAP is finished in 48 to 72 hours. And 90% of the SOAP positions are filled within first 24 hours. All this information can be very overwhelming. I'm trying to squeeze pretty much everything, try to give you a brief overview within a half an hour presentation. If you want to look into more detail on any one of these topics, you can again go to my YouTube channel or website and read more about it. Another reason why you can go unmatched: no US clinical experience, no electives, no clerkships. Your year of graduation is more than 5 years. Again, if that is not supplemented by long-term research or good scores. No research experience, especially if you have low scores, you're an older graduate or applying in a competitive specialty, then research comes into play. Otherwise, you can definitely match without research if you have decent scores, if you're a recent graduate, and if you're not going in a competitive specialty. Visa, again, visa is a hurdle. If you have low scores, you're an older graduate or applying in a competitive specialty, some people first apply for green card, do research. There are different pathways. Once you get a green card, it's not that things are a piece of cake, but they're relatively easier because you can apply to more programs that don't sponsor visa. And then couple match is also a big reason why you can go unmatched, because it's tough to match as a one person. By couple match, you mean you and your spouse, your husband or wife, you both have to match at the same program or at least in the same city to match. So again, couple match can keep you from matching. So I suggest all the applicants who are a couple that one person applies, knows where they're going or where they have matched, then the other person applies next year. And in the meantime, that spouse can do research. And then this is a big one, lack of humility. If you're arrogant, you're a recent graduate with great scores, great communication skills, but you're arrogant. And I talk to you and I'm interviewing you and I can see that vibe that you are very arrogant, then nobody's going to take you. The number two, the two things that all program directors tell me is what they're looking in an applicant is the person is teachable, is humble. You can teach that person. And the number two thing is the ability to take negative feedback or criticism respectfully with dignity. So if you don't have humility, you won't be able to do that. And these program directors, they do this for a living. They interview 500 to 1,000 applicants every year. If you're not humble, if you're arrogant, they will figure that out within first 30 seconds. And you can keep yourself from matching after doing all this hard work if you're not humble. So now briefly about research. I kept talking about research, so I'm just gonna put last couple of slides about research. Research is the biggest reason medicine has progressed and reached so far where it is. It has evolved significantly over past few decades. It gives us answers to unknown questions. How to get a paid research job. I have a very good video on my channel, actually 2 of them, on how to do that. Basically, you Google search top US universities in terms of research, and you pick your specialty of choice, and you start emailing people with your CV. How to interpret research papers. There is a video on my channel about that, how to pick a topic of research. And in the interest of time, I'm gonna skip that. Again, these are a few of the topics that I've mentioned. I've detailed videos on my website, and the reason is I felt as a student at KE that these were the guidance that we were lacking at. My friend Ayaz was able to publish systematic review, case report as a student at KE, and that really helped him get very good electives. He was able to match in neurology. And within 6 months of graduation, he had a residency spot. So research really helps. In the interest of time, I'm gonna not talk about these, and I'm gonna let you watch the videos if you are interested yourself. And one thing I will say, if you're looking to publish or if you're going for a meeting, always start with instruction for authors, instruction for presenters. All right, and before research, you gotta know a little bit of biostat. And for step 1, you will study about this, but these are all the topics that I have tried to address in the biostat course on my YouTube channel. All right, a little bit detail that you can go to the website or the YouTube channel about that. Our motto for this entire process, remember, this is a very difficult, very time-consuming, very frustrating process for everyone. I have been through this myself, and I've mentored now thousands of students. Alhamdulillah, I can say thousands of students. And I can tell this, that one can give up very easily. If anything, I have an answer for you guys to all this. It's just have faith in Allah and never give up, never lose hope.